Hi, I'm Dr. David Bloom. I'm the Senior Cosmetic Restorative Dentist at Aqua Dental. I've been qualified 35 years. 23 of those was in my own practice, so I very much know what works in the long term, and that's really what it's all about, it's longevity. So I'm a general dentist, but with a particular focus on restorative and cosmetic dentistry. I will do everything from the simple to the complicated, but my skills are best served really on restorative rehabilitation cases. So that's wear cases, people who are unhappy with the cosmetics of their teeth, or they've got very heavily restored teeth and they need to be functionally restored as well. We all know that dentistry, however well it's done, will have a lifespan. But we want to make sure that's the maximum lifespan. And people think for veneers that they have to cut the teeth. Often, if we plan appropriately, we can be additive in our planning. And eventually, the less teeth we have, tooth structure we have to remove, the longer the veneers are going to last. So having seen teeth that have been over-prepared and see what happens to those, then it's much better to be minimally invasive because that's what's going to work for the longest term. I'm also proud that I was the second president of the British Academy of Cosmetic Dentistry. We're now the largest cosmetic organisation in Europe, and I'm accredited by the BACD, which is a credential on cosmetic dentistry, and I'm very proud of that. I think BACD brings two aspects. It brings the clinical aspects that you're going to learn, but it also brings you together with like-minded professionals. So our conferences are as much about networking with our colleagues as about learning clinical dentistry. And we are a profession and we are all in it together wanting the same aims. So I think learn your clinical dentistry, but be part of our profession, because together we are much stronger. We did back in 2005 a series called Extreme Makeover UK, and that's really where the public began to see some of the changes that we can make. And thankfully now cosmetic dentistry has a much more positive image because of programs like that. And similarly, many other colleagues have worked on programs like 10 Years Younger. It's getting the message across because it really is life-changing for our patients.